Cynthia Rogers here. Welcome to Help from Whatcom Libraries, resources and information you can trust. This week, our topic is the reopening of Washington State. Yes, it's on everyone's mind. When do we return to our regular lives? So much has changed since the outbreak of the COVID-19 pandemic. When can life go back to normal? In Washington State, your elected officials, such as your governor and your legislators, are working together in your best interest to keep you and all of us safe from COVID-19. Our state officials create public health and safety guidelines to keep as many of us as possible free from infection. No one wants more people to become seriously sick or to die from COVID-19. So what is Safe Start Washington? Safe Start Washington is a plan, a collaboration between the Washington State Department of Health and Governor Inslee. It establishes a data and science-driven four-step approach to reopening Washington, modifying physical distancing measures and minimizing the health impacts of COVID-19. Local public health officials and the Washington State Department of Health will keep monitoring data and numbers and assessing our state's readiness to safely reopen and to prevent the further spread of infection and death from COVID-19. I'd like to talk to you about the 4 phases of the Safe Start reopening plan to give you a short overview. For the high-risk population, that is older adults, people over the age of 65, and people of any age who have a serious underlying medical condition, from phase 1 to phase 4, this population needs to stay home, stay healthy. Then at phase 4, these higher risk folks can resume public interaction with social distancing. For recreation and gatherings, physical distancing is required at all phases. Each phase will increase the number of people who can recreate or gather together, starting from fewer than 5 people together, to then fewer than 50 people together, to finally to the resumption of recreation and gathering of more than 50 people. Now regarding travel, phase 1 has essential travel only, that is travel for groceries, medical appointments, and exercise outdoor. Phase 2 is limited non-essential travel within proximity of the house or your home. And phase 3 and 4 is the resumption of non-essential travel. Now lastly, concerning businesses, over each of these phases, there will be increasing number of businesses that reopen with social distancing and other guidelines. The last and the 4th phase for businesses includes resuming staffing at work sites with continued practice of physical distancing and good hygiene. When do we go to the next phase? Are we all wondering this? So phase 1 of our safe reopening plan began on May 5th, 2020. After discussions with other lawmakers, the governor will in the months ahead issue orders for the state to move into the next phase. We will be staying in every phase for a minimum of 3 weeks. The goal with each phase is to prevent citizens from becoming ill or dying from COVID-19. So during each phase, the Department of Health, lawmakers, and the governor will re-evaluate indicators and determine if the state should remain in the current phase, advance to the next phase, or return to the previous phase. How do we know if we are winning against COVID-19? Important COVID-19 facts and numbers are being collected, tracked, and reported, and all of this information is available to anyone. Every Wednesday, changes in important health numbers are reported to Washingtonians. On the free, public, and trustworthy website, coronavirus.wa.gov, you can look at graphs showing current and historical numbers of COVID-19 hospitalizations, deaths, modeling data, mobility trends, and other important information. From this same website, our lawmakers are looking at various factors in order for us to proceed forward to the next phase of reopening safely. Our elected officials are looking at how prepared are local healthcare clinics and hospitals for an outbreak. How many tests of COVID-19 are we able to do, and how available are these tests? How ready are we to investigate new cases and contacts of COVID-19? And are we well set up to protect people over the age of 65 and people of any age with serious underlying medical conditions from the virus? Now maybe you're thinking, what can I do? Well, as of May 11th, 2020, according to the Washington Department of Health, there have been 865 deaths in Washington state from COVID-19. Now, no one wants more people to die from COVID-19. You and I and other citizens, we can prevent deaths and serious illnesses from COVID-19 by taking these 3 simple common sense actions. Wash hands thoroughly, wear a cloth or a mask over your nose and mouth when outside the home, and keep at least 6 feet away from anyone who lives outside your household. We can keep ourselves and others protected and safe. The more hand washing, face covering, and physical distancing that we all do, the sooner we will have a state and a country that's safe from the deadly COVID-19 illness. To finish up, your public library, the Whatcom County Library System, we also want to help. Contact us, WCLS, to receive a copy of the official 1-page chart that explains, in more detail, the 4 phases of the Safe Start reopening of Washington state. The library, WCLS, we are offering a short informational guide to Washington state's Safe Start reopening. This document has summaries and website links you may find helpful. Our guides are downloadable and printable and can be found on our website, wcls.org/help. We can send you a digital guide through email or send you a printed guide through the U.S. mail. You can email us at refwcls@wcls.org, or if it's easier for you, you can call the number 1-360-305-3600 any day of the week between 1 and 5 p.m. in the afternoon. Library staff are ready to help you. So thank you, and see you next time. And remember, there is help from Whatcom Libraries, resources and information you can trust.